my name is Taylor Chatwin. Today is October 6th and we are going to be doing the heart examination. This is my patient. We're going to start with them at a 30-degree angle, and the heart examination begins with a blood pressure reading. So I'm going to find the brachial artery and brachial pulse. I'm just going to feel where it is so that I know where to line up my blood pressure cuff. There's an artery marker on there. I'm going to put that directly over the brachial artery. Be sure to wrap the cuff around tight, but not too tight to cut off circulation. And I want to be able to fit 2 fingers underneath it still. So in order to start, I'm going to find her estimated systolic pressure. In order to do so, I am going to feel for her radial pulse. I'm going to pump the cuff up, and I'm going to feel when the pulse disappears. So I would say it's anywhere from like right around 100 to 110. So I'm going to add 30 millimeters of mercury when I'm taking her blood pressure reading, and that's what I'm going to pump it up to in the beginning. Pumping it up to right around 140. For her blood pressure, I got 110/72. The next part of the examination is going to be of the upper body, upper extremities. So we're going to start with finding the brachial pulse, which is going to be about 1 inch above the cubital fossa and just medial. So I'm going to find it, and I'm going to hold there for around 3 to 5 seconds. Next, I'm going to find the radial pulse, which is just proximal to the thumb, and I'm going to hold there for around 3 to 5 seconds. Next, we're assessing for color, temperature, and edema. Color of the arm looks good. Temperature, I'm going to feel with the dorsum of my hand. That feels good as well. There doesn't seem to be any edema. We're going to go into skin turgor, which I'm going to pull up on her skin on her hand. And if when I let go it remains elevated, that means that she is dehydrated. Next, we're going to look for digital clubbing, which is the bulbous swelling of the nail. And I'm not seeing that here, so that looks good. And finally, we're going to do capillary refill. We're going to push down on the fingertip for 5 seconds, and it should refill within 2 seconds when I let it go. So all that looks good. Next, we're going to go to the lower extremity. We are going to find the dorsal pedis pulse, which is going to be in between the first and second extensor tendons. Next, we're going to find the tibialis pulse, which is going to be just posterior to the medial malleolus. And finally, we are going to look at color, temperature, and hair loss of the lower extremity. So color looks good. Temperature, I'm going to feel with the dorsum of my hand. Hair loss would indicate peripheral artery disease, which I don't see here. So all of that looks good. Finally, we're going to assess for pitting edema. Pitting edema is if I'm pushing my thumb into her leg, if an indentation remains when I release the pressure, which that looks good here, that would be indicative of heart failure. Next, we're going to go to a chest inspection. In this inspection, my patient would be gowned, and she would be covering her chest area so that I could not see it. So we're going to picture that she is in a gown. We are going to start with the JVP, the jugular venous pressure, and we're going to do that by, I'm going to have her lift her head up and look to the left. We're going to identify the sternocleidomastoid, and we're just going to go just lateral to that, and we're going to inspect for a pulsation. With the JVP, we want it to be less than 3 centimeters from the sternal angle of Louis. That is what is considered normal. From there, we are going to assess the apical pulse, which is going to be on the 5th intercostal space on the left side at the midclavicular line. So I'm going to have my patient shield herself. She's in a gown. I'm going to find the sternal angle of Louis, and I'm going to go down 5 intercostal spaces. Now I'm going to go to the midclavicular line. I'm going to use my light to assess for an apical pulse, which this is the left border of the heart. It is also where you should find your PMI as well. So I'm assessing for that here, seeing if I could see it. Next, I'm going to use my tangential lighting to just assess if there's any other abnormal pulsations. It could indicate atrial enlargement, ventricular enlargement, or an aneurysm. So I'm just going to use this tangential lighting to do so. Next, we're going to go into the carotid palpation. So our palpation section, I'm going to find the cricoid cartilage on her neck, and then I'm going to go just lateral, and I'm going to feel for her carotid artery and pulsations, and I'm going to do that to both sides. Normal beats per minute should be around 60 to 100 beats per minute. Next, I'm going to palpate. I'm going to go down and I'm going to palpate for her apical pulse, the same thing that we just looked for using tangential light. So again, I'm going to go down 5 intercostal spaces. I'm going to go over to the midclavicular line. I'm going to use one finger to try to find where that pulse is. If it's greater than 10, then we will have what's known as cardiomegaly, which is an enlarged heart. That's important to note here. Next, I am going to go to the heaves and lifts. I'm going to set my hand on her chest with my fingers over the intercostal spaces. I'm looking for the lifting of my fingertips, which could indicate atrial enlargement, ventricular enlargement, or it could indicate both of those. Great, I'm not seeing any of that there. And finally, I am going to feel for a thrill. I'm going to use my ulnar side of my hand. The thrill is going to be a vibration that indicates turbulent blood flow underneath or in the heart, and that could indicate stenosis. So that is something that could indicate. And I'm not feeling any of that here. So from this point in the exam, if I wasn't able to find her apical impulse, or apical pulse, I would use percussion to do so. So that would be at this point. Next, we are going to the auscultation, which is listening to the heart sounds. So with auscultation, we have our bell side, which is for low pitch sounds. That's going to be your S3 or your S4. And with your diaphragm side, we're going to listen to high pitch sounds, which would be your S1 or your S2. So both of those would be heard there. For different heart sounds, I have her AV valve, which is going to be in the 2nd intercostal space on the right side, just lateral to the sternal border. And then I have her pulmonary valve, which is on the left side, 2nd intercostal space, just lateral to the sternal border. I have her 3rd heart sound, which is going to be Erb's point. You can hear the aortic valve or the pulmonary valve at this point, and that's in the 3rd intercostal space on the left side of this, just lateral to the sternal border. That's your 3rd point. And then you have your 4th and 5th intercostal spaces, which is your tricuspid valve. Those are on the left side, just lateral to the sternal border. And finally, we have our mitral valve, which is heard at the 5th intercostal space at the midclavicular line, so on the left side of the sternal border, at the midclavicular line. So you go just a little bit further. So now we are going to listen for all of these sounds. I'm going to use my bell side first. And now I'm going to use my diaphragm side. Now that I've listened to heart sounds, 2 irregular heart sounds are going to be your S3 or your S4. Your S3 is a ventricular gallop and your S4 is an atrial gallop. Both of those are going to be considered irregular heart sounds that you might find within the heart. That concludes my heart assessment today. Let me do my 360 with my camera. Okay, bye.